Hello, assalamu alaikum. Welcome back to my channel. This is Dr. Sana. We are dealing with a new topic today. So let's start. Bismillah, alhamdulillah. Today we are talking about the sexual response sexual cycle of a male and female. The reason I took this topic is there is a lack of sexual knowledge, the knowledge of sexuality in our community, mainly because we are shy to talk about this topic or inappropriate sexual education. People may think it is not good to talk about these topics with the kids, or but in reality, we actually need a good sexual education to our community, because when we get the patients, we see that the lives of the people who are going through intimate relationship with spouse, what they face is they are lack of sexual education. What they get from internet or from the peers or from surroundings, it is not the actual knowledge, and what is they are getting as misconceptions. There is a common misconception that we all grew up. Some people may say that we all grew up and we reached this stage. It is not necessary to have a separate class for this topic for the kids. You are really wrong, because now the world is so advanced. All the people are getting knowledge and right knowledge through proper channels. Due to our misunderstanding, some people may restrain their kids getting such proper knowledge from authority itself. So before start, all should know that sexuality or sexual intimacy is a basic need that Allah put in your mind for your benefit, for the benefit of the humankind. So, to gain the knowledge on that subject is not a sin, it's actually a benefit. To know about your spouse or to know about your better half, it's really necessary. Sometimes I had seen people who entered in the marriage, they don't know anything about the sexual intimacy. Most of the females, even at 90% of the females, didn't even experience what is their climaxes. I believe it is maybe because of lack of sexual education during the childhood days. So let's start today's topic. So, sexual response cycle for male and female. There are many studies taken on these topics, and a widely accepted sexual response cycle has four stages. First stage is desire, second stage is arousal or excitement, and third stage is plateau, and the fourth stage is orgasm or climax. Stages of sexual responses, four stages, and the last one is resolution. Fifth one is resolution. We can have a detailed talk about these stages separate. Before we start to go into each stages separately, let me give you an important point is that you should seek consent from your spouse. This consent, it can be withdrawn at any time, even between the married partners. The consent is a must thing you should seek while during the sexual intimacy. So let's go to these four stages separately. For the females, first stage is desire stage. It is mental and emotional phase. It usually starts from the brain for the female, not from the body. It's triggered by emotional safety, attraction to the partner, touch, smell, memory, and fantasy. What happens in this stage is increased blood flow to the genital organs. Brain releases a chemical called dopamine, which creates a feeling of wanting, and another chemical called oxytocin, which creates a feeling of bonding. During this phase, the thought become more romantic and sexual. Important facts that you should note that many women experience responsive desire, meaning the desire begins after touch and intimacy, not before. Stress, fear, unresolved conflicts, or disrespect can shut down the desire instantly. Trauma or coercion completely blocks this stage. So, you should make a female ready for the intimacy. And the time period for this desire stage may last a long time, minute to days. or it can be absent or appear only after one touch. Now, the second stage. Second stage is arousal or excitement stage. This is when the body shows visible physical signs, the changes in the body externally, the clitoris swells and becomes sensitive. Same type, labia swells and darkens, vaginal opening relaxes and expands. A natural lubrication begins from the vaginal wall and Bartholin's glands. Internally, uterus lifts higher in pelvis, creates space, vagina lengthens called tenting, blood flow increases to pelvic tissues. Breast become fuller, nipples hardens, heart rate increases, and blood pressure rises. Skin may flush. This stage takes longer for the females than for males, like 10 to 30 minutes or more. Gentle foreplay is needed. Patients which I got, while they were talking about their intimacy relationship with their spouse, they complained that to their spouses what they mean by due to the lack of their sexual education, or due to the knowledge which they obtained socially. I don't know why they complained about that. To their spouse, what foreplay means is that making the female feel the pain. One thing you have to keep in mind that most of the female cannot enjoy the pain during sexual intimacy. Most of the female enjoys only soft touches and caring, like pampering movements. The hard touches and making them feel the pain in any kind, they don't enjoy that much. They may have a lubrication. What the male understand is, when they see the lubrication in the vagina, they mistook that the females are enjoying whatever they are doing. That's a misconception in this area, because they may have some kind of, or some kind of lubrication if you touch or do foreplay. If you touch them, the lubrication in the vagina is not because of, but it's not due to enjoying. The pain usually shuts the brain of the female, and they cannot enjoy that much the process you are engaging. So bear in mind, the pain or the hard touches are not that much enjoyable to the females. So we are in the second stage. The time for this phase is 10 to 30 minutes on an average, sometimes takes longer. Physical signs like lubrication and swelling begins. Women usually need gentle touch, emotional connection, safety, comfortable environment. For some women, it may take only 10 to 20 minutes. For many women, it is more than 40 minutes. Okay. Now we are in the third stage. This is the plateau stage, or intensification before orgasm. Okay. If stimulation continues, the clitoris become extremely sensitive, maybe fuller under clitoral hood, may pull under clitoral hood. Lower third of the vagina tightens, breathing become rapid, muscles tense, focus narrows to the sensation, and pressure builds in the pelvis. Some women feel urge to move hips, to make sounds, increase emotional vulnerability or closeness. This stage can last seconds to many minutes. This may take 5 to 20 minutes in most of the females. This is left unspoken but very important. Sensation intensifies, body prepares for orgasm, and rushing this stage reduces or blocks the orgasm. Okay, next stage is orgasm stage. It's usually sometimes up to 3 to 20 seconds, or sometimes up to 1 minute. At orgasm, uterus, vagina, and pelvic floor contracts rhythmically. Strong pressure waves, intense brain dopamine release, emotional release or joy. In some women, ejaculation, female ejaculate or skinny glands secretion occurs. There are many different types of orgasms: clitoral orgasm, vaginal orgasm, blended. Best for many women. Many women do not reach orgasm from penetration alone. Clitoral stimulation is essential for the most of the people. The last stage is resolution stage or afterglow. Body returns to the normal, swelling reduces, muscle tension decreases, breathing slows, warm, sleepy, peaceful feeling, desire for cuddling, or woman can become aroused again quickly, no refractory period. Point it should be noted that women can be aroused again quickly, no refractory period. The time period of this phase is 10 to 60 minutes. Deep relaxation, emotional openness, body cools down gradually. Women can become aroused again fairly quickly. Now we come to men's sexual response cycle. The first stage is desire stage, often more visual, hormone driven, influenced by testosterone. This can be triggered by what he sees, physical sensation, fantasy, smell. The brain chemicals such as testosterone drives dopamine motivation and less dependent on emotional safety. Mostly, this stage less dependent on emotional safety. The second stage is arousal. Physical changes, the penis filled with the blood goes to erection. Testicle lifts up and enlarge slightly. Skin of the scrotum tightens. Pre-ejaculate or clear fluid from the Cowper's gland. Heart rate increases. This stage is usually fast in men, seconds to minutes. Most males, it is within 5 minutes. On an average, the males, it is within 5 minutes. Now we reach the third stage, just before the stage of ejaculation, that is plateau stage. Penis is fully rigid. Glands or head of the penis become darker, and pelvic muscles begin rhythmic microcontractions, like a slight shivering or rhythmic microcontractions occurs. Sensation is extremely intense and sense of control decreases. At this stage, stopping stimulation may prevent climax for some time. So the third stage is, the time period of this stage is 2 to 10 minutes. Until ejaculation, the time may varies from 2 to 10 minutes. This time is most people refer to as sexual duration or performance time. Usually the males, it experiences from 3 to 7 minutes in common. If it is under 1 minute, it is called a premature ejaculation, or over 20 minutes with no climax, it is called delayed ejaculation. And the fourth stage is orgasm plus ejaculation. In this, two processes occurs: orgasm, brain experiences pleasure peak, and ejaculation, semen released in rhythmic spurts. Prostate, seminal vesicle, vas deferens contracts. Most men have single orgasm and then lose erection, are very sensitive afterwards. The duration of this stage is usually from 5 to 15 seconds. Rhythmic ejaculation spurts and then immediate sensitivity. Okay, the resolution or refractory period. The time period is 5 to ranges, or the duration ranges from 5 minutes to 24 hours, depends on age and health. Young men, it is 5 to 30 minutes. Middle age, more than 90 plus minutes. 90 minutes. Older, hours to a day. During this time, erection is not possible. These resolution or refractory period, erection is not possible. So whatever knowledge you gained or you learned from other means, it's false. So refractory period needs more time with age. After ejaculation, penis becomes soft, body relaxes, sleepiness occurs, and loss of interest temporarily. The refractory period can be minutes to hours. No erection possible during this time. Okay. From the description, you may have seen that there is a key difference between male and female. Let's talk about the differences between male and female. For women, slower arousal phase. For the man, it is arousal is faster. Mostly need play for the females, mostly visual. Just go like that. Female can have multiple orgasms. Usually single orgasms occurs in men. Need emotional safety for female, need physical stimulation. For women, desire may be responsive for men, but it is for men, desire usually spontaneous. No refractory period for female. They can have arousal immediately after one phase, one round. For male, they have a refractory period. So now let's talk about how to balance this mismatched time in a relationship. Female is having a need more time, and for a male, it can happen within younger ages. Younger males, it can happen with spontaneously. It only takes half an hour for some men for stage 1 to stage 4. Then the refractory period occurs. Okay, at that time, for his partner, for this for half an hour, she only started to have experiencing her arousal. There is a mismatch in the time period between male and female. What you should know is that Allah created female like that they need a longer time to get ready for the intimacy. So you are the person, you the male, the men, the men are the person should understand this mismatch and making her to ready for the intimacy. So let's talk about how to balance this mismatch. Okay, the most common problem in intimacy is men get ready fast and female get ready slowly. Okay, when a man rushes, a female feels used instead of invited. So what you should keep in mind that you should make her feel invited, not be used. So solution is not to make her faster, it is to slow him down and support her natural rhythm. What balancing means, a woman needs emotional connection, safety, soft words, gentle touch, time. A man needs awareness, patience, self-control, and focus on her comfort. Healthy timing in real life is desire takes seconds to minute. She usually needs minute to hours or more. Arousal time 1 to 5 minutes for men, 15 to 30 plus minutes for female. Orgasm quickly and often she won't experience without a foreplay. Okay. So, in one of my patient couple, the female was complaining about the nature of the foreplay of her spouse. That for him, according to him, the foreplay is touching here and there. Then he lie down on the bed and making me to do everything to him. So you should understand that each woman, whatever you see or you find in the fancy stories or the online stories like that, whatever you see in the online or fancy stories is not real. The real thing is she needs time, and you are the one to make her ready. And also, that is not from the heart touch or beating or something like that, making her feel the pain. Our brain has a problem that pain shut down the enjoyment. Our brain is constructed in a way that pain usually shut down the enjoyment. There is another misconception in the intimacy is that he feels the pleasure while touching on his private part. Is it because his private part or his sexual organ lies outside the body, but the female sexual organ vagina, it's inside the body. There is the two main difference between male and female sexual organs is that male sexual organs lies outside the body and female sexual organ lies inside the body. That's vaginal canal towards inside the body. So what happens is, for outside the body, the parts outside the body, there is a covering of the skin, and the skin has a lot of nerves or nerve endings on the skin. So while we touching or the pleasure, pain, touch, everything is experienced on the brain through these nerve endings. So what happens is an ability to feel the pleasure because of there is a lot of nerve endings on covering in on the male sexual organ, but the female organ, vaginal canal, has lower third of the vaginal canal which we can access has little or no nerve endings over there. There is no skin lining over the vaginal canal, so there is little nerve endings over there. So the touch cannot be experienced. The touch cannot be experienced through that canal. That's how the creator created the human body, because human female body, because that is the channel where the baby comes. Through where the baby comes. If there were a lot of nerve endings over there, the pain during childbirth will be unbelievable. Very little nerve endings. There is only one portion or anterior wall which we usually calls as G spot. It is actually the backside of the, now it is discovered as the backside of the clitoral or the clitoris, where the clitoris lies. There is only the nerve endings, or which we usually calls as G spot area or G spot portion. We were talking about the mismatching. Yeah. The solution is intimacy should begin long before bedroom. Kindness during the day, respectful words, emotional connection, affection without pressure. For a woman, the mind must feel safe before body opens. The second point is the natural ways to delay male climax and support female readiness. This is about control, breathing, and awareness, not medication or explicit method. For a man to slow down naturally, slow breathing, inhale through nose, exhale slowly through mouth. This calms the nervous system and delays the climax. Pause awareness. If the body feels close to ejaculation, stop the movement for a moment. Focus on her face, breathe, or hands instead. Reduce pressure to perform. Performance anxiety makes it faster. When the goal is connection, control increases naturally. Okay? Longer foreplay is equal to slower climax. If a man focuses on her pleasure first, he naturally lasts longer. For women to increase the readiness and pleasure, longer warm up time, kissing, holding, kind words. This is not extra, it is essential. Comfortable and private environment is a must for the couple. No fear of disturbances, low light, warmth, privacy, etc. Body relaxation is needed. Deep breathing, relaxing hips and abdomen. No stress. The other point is no criticism or sarcasm. Even one hurtful word can shut her down. Okay, so I think you get the point which I want to convey to you today. And this is the end of today's session. I hope you enjoyed the lesson, and thank you for watching this video. Assalamu alaikum wa rahmatullahi.